not only has the pandemic posed an extreme risk to people who are already disabled, it has also been a mass disabling event. And that is something that we don't feel that we're hearing represented in the top line message from the CDC or from other government actors. The truth is, we don't know, and we probably won't know for a long time how many COVID cases, especially in this current spike, may cause long COVID. And we've seen some study results that have estimated ranges as high as 1/3 to more than 1/2 of COVID survivors may develop temporary or permanent long COVID disabilities. As someone who has attempted to navigate accessing adequate care in this pandemic as a post-viral illness patient, I have to say it is gravely distressing to me every time I hear it suggested that our society should simply accept that most people will get this virus, knowing how many millions of Americans might be grappling newly with long COVID at this moment. Until last January, I was in perfect health until I caught a run-of-the-mill mild, not COVID, winter virus, just a virus. We thought it would go away in a couple of weeks, and it triggered post-viral illness very similar to long COVID, including intractable chronic pain, dysautonomia, postural orthostatic tachycardia syndrome, and severe chronic fatigue. What scared me most was actually not the fact that I was a 26-year-old who one day could get out of bed and the next day I couldn't. What scared me most was how equipped more than 12 different doctors in 6 months seemed to be to help me. They did not know what to do. My mother, who has spent the pandemic as the charge nurse on my hometown hospital's COVID unit in Fort Collins, Colorado, collectively, she and I could not determine how best to navigate the exact healthcare system and hospital in which she has worked for 13 years and from which I received competent care for the first 21 years of my life. I think just about any post-viral illness patient would tell you that the structure of our current medical system is not designed to catch, diagnose, or long-term or short-term treat post-viral illnesses, and I felt like I was falling through the cracks. Becoming newly disabled or chronically ill during a global pandemic is an experience that I would not wish on anyone. As soon as I realized the increased risks that I faced by developing a chronic condition during this time, after hearing my mom's stories from the hospital, and after witnessing the way that disabled and chronically ill people had been treated during this pandemic, there are no words for how scared and vulnerable I felt. Every time I went to the grocery store and saw somebody who wasn't wearing a mask, the message I received was, "I'm done with this, and I don't care if that kills you." It was one thing to receive that from people in society, but to be honest, since Omicron hit, it feels like the entire healthcare system, medical system, and government have kind of conceded that point as well. And it has been the most painful moment for me personally since when I realized how at risk I was when I got sick. I moved more than 1,000 miles at enormous fiscal expense to get access to the doctors that I needed back in DC, something most patients cannot afford to do. And then I became part of the 25% of dysautonomia patients who get a diagnosis in the first year. Once I had that diagnosis, which I thought was supposed to be the hard part, it was still unclear how to proceed with treatment. Patients are suffering. Autonomic dysfunction has emerged as a common symptom of long COVID. We know that dysautonomia is a common feature of other post-viral illnesses. In 2013, Dysautonomia International, say that 5 times fast, conducted a survey of 700 patients that found that the average diagnostic delay for those patients was 5 years and 11 months. 50% of patients traveled more than 100 miles from home to receive POTS-related medical care. And prior to being diagnosed with POTS, 59% of those patients were told by their doctors that their symptoms were likely all in their head or a result of mental health issues. 27% of patients visited more than 10 doctors for their symptoms before being diagnosed with POTS. Please hear me when I say that if only 5% or 1%, let alone 1/3 or half of COVID patients are becoming disabled by long COVID, far too many hundreds of thousands of Americans are currently suffering greatly while simultaneously being told that their suffering is not real or will resolve on its own in a few weeks. This is a great injustice. We appreciate the significant research that has been invested in addressing long COVID, but we believe that the CDC and the federal government as a whole must do more, not just on long COVID, but on post-viral illnesses in general, about which the medical community seems to know very little at this time. People developing long COVID are suffering and are struggling to access care because of lack of research dollars previously that were not decided to go towards conditions like myalgic encephalomyelitis, chronic fatigue syndrome, postural orthostatic tachycardia syndrome, dysautonomia, and fibromyalgia. Research initiatives on long COVID must include these similarly presenting conditions. And if the CDC cannot prevent these patients from getting COVID, then the very least these patients are owed by their government is for the government to be extremely committed to responding to the ways in which their health and lives have now been changed by getting this virus. Becoming disabled is not a tragic thing. It is a normal part of life and of the human experience. But becoming disabled and feeling failed by the medical system, your doctors, society, and your government is tragic and it is wrong. And the CDC should be prepared to use all of the tools at its disposal to embrace being responsive and responsible to the patients who did get this virus and who were lucky enough to survive it and now are looking at the rest of their lives.